Next up is talking about drug and alcohol screening. Now, drug and alcohol screening is required to be in the clinical portion of the program. You must do it at the lab that we specify. It is done at your expense, and they are randomized and unannounced. When you sign up for your drug screen, you have 48 hours to complete it. So we walk in and we say, okay, everybody sign up for a drug screen. That drug screen has to be completed. You have to have gone to the lab within 48 hours. Failure to meet the deadline means you cannot be in the program. And what happens if you have a positive result? Well, positive result means, of course, you cannot be in the program for that year. But if you have a question about the result, you come to me and you say, there's no way in the world ever it could have been positive. You have to work with the lab directly, not with us. We can only go by what they report to us. You will also be required to have background checks. Now, we have to be in compliance with the Protection of Elder and Children Abuse Act. This lists certain offenses that could prevent you from working around children or elderly patients. So if you have anything on your criminal record, you need to let me know. If you have nothing on your record, but while you're in the program you get something on your record, you also need to let me know that, because we have to look into all of this. We do not accept anyone with anything on their child abuse clearance. So the background checks that you will be doing are the Pennsylvania State Police, the FBI, and of course, as we said, child abuse. All three of these must be done every year that you are in the program. So you will do them a minimum of twice. Again, these are at your expense. You pay for these when you sign up for Castle Branch during the orientation. If you have something on your record, there is a prohibitive offense procedure. You can find it on the HAC website under the program's Health Careers, or you can come and speak to me. I am the chair of the Prohibitive Offense Committee here at HAC. Now, as I said in the last video, we recommend that you have about $300 available to you. Again, Castle Branch does not accept American Express. That $300 is going to cover your background checks, your drug and alcohol screen, access to the Castle Branch, your AARC membership, and any other type of miscellaneous things that need to be done. That would include your physical and any blood work that they want to do. And as I said previously, start to replenish it. You never know when you're going to walk in one day and we're going to say, hey, it's time for a drug test. You will have 48 hours to complete it. Next, let's talk about tobacco, smoking, and vaping. Now remember that as a respiratory therapist, you need to understand the dangers and the hazards of this. But it is an addiction. If you currently use tobacco, if you currently smoke, if you currently vape, clinical sites do not allow the use of it, even in your personal car during lunch breaks, because it is on their property. By the way, HAC is a tobacco and vaping free campus as well. So you cannot do those things here at the college. The clinical sites may require testing at your expense. Currently, none of them are, but if they all of a sudden decide they want to, we want you to know up front that you would have to submit to this test and you would have to pay for it. It would be a urine test. Let's talk about some hazards. So while you're in the program, you're going to perform procedures which could expose you to bloodborne or airborne pathogens. It's our job to teach you how to protect yourself against these. But accidents happen. If you get injured at the school, in the clinical, in our lab, you are responsible for any medical expenses. The hospital nor the college are responsible. Some of the hospitals will pay for or cover you going to their emergency room, being seen and assessed, but any follow-up to that you would have to pay for. In the respiratory therapy handbook for clinical, we do have a policy how we handle this. And if you are injured at clinical, you must go to the emergency room. And the last thing to talk about in this video is previous employment. Have you ever worked in a healthcare institution and been fired? If you have to notify me prior to admission to the program. And the reason for that is if you have been terminated and you're put on a do not hire list, they may not allow you to come there for clinical. It doesn't have to be just a hospital. If you work at a doctor's office, a nursing home, anything like that, and you were terminated, you need to inform me. While you're in the program, if you are working at a healthcare institution and you get fired, you must notify me immediately. Again, the same process applies. I have to make sure that there is no problem with you going to an institution and you may have been fired from that institution or by that parent company. All right, next we're going to talk about our final admission video. And we're going to talk about our internship process, uniforms, other types of things.